Good morning, students. Today, we'll be starting with a new topic. So, that is the introduction to public health. I, Dr. Anigha Agrawal, I'm a reader in Department of Public Health Dentistry Department. So, we just start with the new topic that is introduction to public health. Means once you enter the department, you should understand the difference between in general health of the public and how it is related to oral health. Why we need to learn this topic is because there is always a relationship between general health to public health. So we'll be discussing this topic under following contents. So very first thing is now we want to learn about the health. So you must know what is health. So by WHO in 1948, they have given a definition of health. That is, a health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity, to lead a socially and economically productive life. So, what does this mean? What does this definition mean? Is health is a state. Okay, it's a state. So, it can change over a period of time. There is no constant of complete physical, mental, and social well being. So, only physical well being is not taken into consideration, but mental well being as well as social well being also should be there for that particular person. And not merely the absence of disease. So only absence of disease will give you physical well-being, whereas mental and social well-beings are equally important to be a person called as health or infirmity to lead a socially and economically productive life. So how that person should be, that person should live his life with all the dimensions with socially and economically productive life for that particular nation. So that is the basic definition of health. Now, the definition of health gives you the aim at which you have to reach with your health. But all the time, it is not possible for every individual to have a complete well-being of all these three things. There has to be some other ups and downs into the health. So we have an operational definition, so which will tell you how much should be the optimal health that you have to attain. How much should be the optimal health that you have to attain into your day-to-day life. So, in a broader sense, health can be seen as a condition or a quality of human organism expressing the adequate functioning of organism in given condition, genetic and environment. So, at whatever condition you are in, even if you are not completely healthy, but in whatever condition you're in, your functioning should be adequate for that particular environment or for that particular condition. You should function adequately in that particular environment. That is the broad sense. Whereas in narrow sense, there is no obvious evidence of disease and that a person is functioning normally. Several organs of the body are functioning adequately in themselves and in relation to one another, which implies a kind of equilibrium or homeostasis. So I'll give you an example. For example, a person with hypertension. Okay, so that person is having a disease. Right now, that person is deceased. But with the help of the medication, the modern medicine, he can stabilize his BP so that he can work normally in that particular condition, with that particular condition also. So in narrow sense, there will be every cell and organ, they are adequately functioning into your body to, which implies a kind of equilibrium or homeostasis. That means by outwardly looking, you won't be able to understand that this person is having some disease because he is under medication. But because of that medication, he can function properly. The disease won't hinder his day-to-day activities. So that is the operational definition of health, where you have to attain such amount of health that you should do your day-to-day whatever work you have been assigned properly under that particular condition. Okay. Now, we have learned about the health, but what is the public health? So, public health is a study and practice of managing threats to the health of the entire community, not to one person. Here we are considering the entire community. The goal of public health is to improve lives through prevention or treatment of particular disease. So, this is the goal of the public health, to improve life of that everyone that is present into that community through prevention and treatment of that particular disease. Now, this is the definition of public health. According to Winslow in 1920, public health is defined as the science and the art of preventing disease, prolonging life, promoting physical and mental efficiency through organized community effort for sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of the medical and nursing services for the early diagnosis and preventive treatment of the disease, and the development of social machinery to ensure everyone a standard of living adequate for the maintenance of health. So, organizing these benefits as to enable every citizen to realize his birthright of health and longevity. Now, this is a too big a definition, so I've fragmented this definition into some parts to make it more understandable. So what this definition says is the it is public health is defined as a science and art of preventing disease. That means stopping that disease from happening, prolonging life. That means once the disease process has stopped, the life will be prolonged, and promoting physical and mental efficiency. So if you're disease free, your efficiency, may it physical or mental, it will be more as compared to the people who are deceased through organized community effort. So only one person do not have to have that effort, but the entire community need to take the effort to do all these things to prevent the disease, to prolong the life, and to promote physical and mental efficiency. How will they do that? That is why for the sanitation of the environment, by sanitizing the environment around us. So if we stay in a good and a healthy environment, we won't be catching any diseases. The control of communicable diseases, to control the infectious diseases, the education of the individual in personal hygiene. So that was the very first thing that we need to think about. The organization of medical and nursing services for the early diagnosis and preventive treatment of the disease. So once you go for preventive treatment of the disease at very early stage, the damage done by the disease to that particular person will be minimized. That's why we have to catch hold the disease as early as possible. And the development of the social machinery to ensure everyone a standard of living adequate for maintenance of health. So thus, by doing this, what we will be achieving, we will be achieving a social machinery to ensure everybody a basic standard of living adequate for maintenance of their health for long period of time. So organizing these benefits as to enable every citizen to realize his birthright of health and longevity. So this definition gives every person the birthright of health. Since they are born on this earth, they have this right to health and right to longevity. Okay. So some brief history of public health. This is Edward Jenner. In 1796, what did he do? He found out the first vaccine of smallpox. So what did he do is he found out that there is a disease similar to smallpox that is known as cowpox. Okay, now this cowpox, what he has understood on observation that the people or who used to keep cows, and they used to get infected by this cowpox because of the cows, but they became immune to smallpox, which is a another deadlier infection similar to cowpox. So what he did is he actually took out that pus of cowpox from a pistol of a cow, and he injected into one of the small children, and he found out that that child did not develop smallpox in future. So such a way he developed a a vaccine or a preventive strategy for smallpox. Then there is a second, that is the miasma theory of the disease. In the Middle Ages, what they used to say is miasma is the pollution. That is a Greek word for the pollution used to explain the spread of the cholera. So what does this mean is what they used to think that pollution is the reason for every disease. At that time, as there were no microscopes, so people were not knowing there are some smaller things or smaller living things are there, like bacteria and viruses, which may cause the disease. So what they used to think is the pollution is the only reason for whatever problems or whatever diseases we are having. Later on came the germ theory of the disease. by John Snow in 1854. So what John Snow said is that there are small germs which are present into environment. These germs they get inside our body through the cracks of our body or through the openings of our body, and they're responsible for causing some kind of a disease. So this theory came up by Dr. John Snow in 1854. So like that, infectious diseases theory have come up, and now in the modern area of public health, where we have stopped many of the infectious diseases by finding out preventive procedures for them. So newer or the modern public health diseases they have come up. The like multidisciplinary diseases, multisectorial diseases, evidence-based diseases, and equity-oriented diseases like cancer, like diabetes, like hypertension. So you can see there are no organisms which are involved. These are totally dependent on life. These are totally lifestyle diseases, and there is no differentiation like poor may get this disease or older people only may get this disease. So these are the modern diseases. Those have come up. Now we are more concentrated towards preventing these diseases by modifying our lifestyles. So this was a brief history of public health. Then there are some determinants of health. That means the factors which are responsible for our being healthy. So very first is income and social status of that person. So what they say is, if you have good economical status, then a socioeconomic status is better, then there is a good health to that kind of a person. Employment, so if the person is employed, he'll be having better health. Education, if patient is well educated, he'll understand the very meaning of prevention of that particular disease and will follow whatever the doctor has to say. The social environment, that means the environment around that person. If there are people who take everything lightly, there are people who actually say that whatever happens because of God and everything. So person around will influence, the peer pressure will be there on that person, and that person won't go for a help from a medical professional, and the disease will be there, and the person may die because of that disease. Whereas there is another scenario when there are people who are more aware of the disease, the preventive strategies and everything. If the peer pressure is there, the person will show it, his symptoms, as early as possible to the doctor, and the disease process can be stopped then and there. So that is the importance of social environment. Then the physical environment, like temperature, or how much is the hygiene in the area where you live, so that all comes into picture. Then the healthy child development, so if you inculcate healthy habit into children since their childhood, they can carry those habits till their adulthood, so there will be less amount of diseases. Then personal health practices and coping skills with whatever stressful situation they come into your life. Then the health services, so what are the health services? Those are around, whether they are accessible, whether they are affordable, social support networks, biological and genetic endowment of that particular person, whether that person is genetically susceptible to some of the diseases or not. Then gender, so there are some gender dependent disease like pregnancy related diseases like gingivitis. So women during their puberty or during their pregnancy or during their menopause, they are susceptible to such kind of a gingivitis because of the hormonal changes. And the cultural activity, because of which some people may fall ill more as compared to other people. So these are all the determinants of health, or they have a role in determining your health status. Okay. So depending upon this, the authors have made some changing concepts of health. That means the health had changed, the perception of health had changed from era before medical fraternity was there, when people used to think that everything is because of wrath of God, till now when people understand that every disease have some or the other reasons behind. So one by one we'll be going. First is the biological concept, second is the ecological concept, third is a psychological concept, and fourth is the holistic concept. So very first, that is your biomedical concept. So what does this concept says is, biomedical concept means They consider germ theory of the disease as their basis. That means every disease has some germ behind. So every disease is caused by some or the other germ. So if you stop that particular germ from infecting you, there will be less amount of disease for you. But this theory could not explain the some of the mental diseases or the social diseases. Okay, so this concept was refuted, and another concept came in, that is the ecological concept. Now, what do you mean by ecological concept? Eco means environment. Okay, eco means environment. So this concept says that uh, as miasma, now this concept is based on miasma theory. So they believe that every disease is not only by the agent or the germ, but environment is equally responsible. So either the environment is not working properly, or the human being is not working, the system within the human being is not working properly, or both are responsible for having a disease. Now again, this concept was refuted by mental health issues. Then third came psychological concept, where they're more concentrated on mental health and social health of that particular person. So what they say is, if you're mentally, if you're not sound, socially, if you're not sound, you cannot perform normally in your day-to-day activity. But again, germ, like some infectious diseases and modern day diseases cannot be explained on only this psychosocial or psychological concept. So there came the holistic concept. Now holistic means everything included. Holistic concept is the total concept which represent biomedical concept, ecological concept, and psychological concept, which means that it has all the three dimensions included. That means every disease have either a germ or the bacteria or the viruses or some kind of a biological factor which is behind. Then there is some environmental factor is also there. There has to be there to for that disease to happen. And third thing, there has to be some social or the mental things which are responsible for a disease to happen into man. So holistic concept was actually accepted by all as better theory of health than any other concept. Okay, now the next concept is spectrum of health. Spectrum of health. So what do you mean by spectrum of health? Spectrum means, as I've already told you, health is a state. Okay, it's not a constant thing that once you attain this much amount of health, you cannot go down or you cannot go up. So it's a spectrum where you come and go up and down, up and down. Like right now, you're in a good health. You can walk properly, you can work properly, you can study properly, eat properly, sleep properly. Okay, but suddenly, because of this bad weather right now, which is there outside, you may catch cold. So level of your health will go down, slightly down, where you're having a mild disease like flu. Okay, at that time you may not be able to concentrate into your studies, right? So you are at a level, lower level of health as compared to other time. And when you take medication, you recover out of that disease again, you can attain your level of health. So it's a continuum on which your health comes ups and down. So health is a dynamic phenomenon. It's not a constant phenomenon. Transition is often gradual, and where one state ends and the other begins is a matter of judgment. So there is no clear-cut distinguish between absolute positive health that we can see on this continuum, that there is no disease. That is the definition of the health that we've understood in the previous, like the very first slide. That is positive health, absolute positive health, which is like unattainable, absolutely unattainable, absolutely. मैं आपको मना कर रही हूँ, आपको समझ में नहीं आ रहा है? Okay, so that was the positive health. Then, if you catch, like I have told you, if you catch cold, then it will become a better health. Okay, better. Or maybe there are some things which are going on inside. There are some hormonal changes. You do not have any problem with that are going on. So you are actually not in a total good health, but you're free from any sickness. So you're at the uh, lowest level of your health that is free from any of the sicknesses. Okay. Then when you actually catch the cold, at that time you have unrecognized sickness. That means the bacteria are there inside your body. They're multiplying. They're not causing you any harm. So that is unrecognized sickness. Then comes the mild sickness where you start with having some cough and cold and later on some fever, and then you will be having, if you do not treat that, you will be having severe sickness because of that, that is pneumonia and ultimately the death. So this is a continuum. Health and disease lie in a continuum and there is no single cutoff point for it. Okay. Now we should start with a new thing, and a very important thing. To understand each and every disease, you need to learn this epidemiological triad. So this is a concept of causation. So how things are getting there, as in how the disease is caused. So very important, very well versed and everywhere accepted first concept of causation is epidemiological triad. So it has, as I told you, it's a triad. There are three things, that is agent, environment, and host. Now, agent means the one thing because of which, presence or absence of which may cause you a disease. So that's a agent. Environment means the environment around that particular bacteria or that particular agent and that particular host, which is making that agent to work for that particular disease. And the host is the person or the tissue or the organ who's harboring that particular disease. Okay. So again, this is a epidemiological triad for periodontitis. So one more concept along with this that came in was epidemiological tetrad. So what do you mean by epidemiological tetrad here? Tetrad means one more thing has been added. That means there are four things which are responsible for that particular disease. So the fourth thing which was added to agent, host and environment was time. The time factor was equally important. So as you can see, we'll go now one by one. I've just given you an idea what does that agent means. So agent is an organism, a substance or a force, the presence or lack of which may initiate a disease process or may cause it to continue. So anything because of which the disease process is there, whether it is present there because of excessive presence of which or because of lack of which there may be a disease. There are types of agents like living agents like bacteria, viruses, protozoa, right? Or the non-living agents like for deficiency of some of the vitamins or deficiency of some of the minerals. So they can happen as the agent because they are not there, lack of which may initiate the disease. Then the nutrients, then some of the chemicals like external chemicals or internal chemicals like cholesterol. If you have high amount of cholesterol, then you will be having a disease. So here the cholesterol is acting as an agent. Then some physical agents like excessive heat. Okay, excessive cold or excessive pressure may act as an agent to cause you a disease. Then second thing is host. That means the person or the animal or the tissue that affords subsistence or lodgement to an infectious agent under natural conditions. Okay, so demographic characteristics, the types of the host are demographic characteristics, various demographic characteristics of that particular host where that will making that host susceptible for that particular disease. For example, age. As we know that young children and the older people, they are more susceptible to some kind of infectious diseases because they lack amount of immunity. So age is one of the demographic characteristic which will make them more susceptible for that particular disease. Then biological characteristics like whether that even like gender, you can say gender is a biological characteristics where some genders are more prone to have that particular disease. For example, I've already given you an example for this, like females, due to hormonal changes during puberty, pregnancy, menarche, or your menopause, they are more susceptible to have some kind of a gingival disease, right? Socioeconomic characteristics which will make people uh, access the health services early or late, and the lifestyles, various kinds of a lifestyle that patient have. So if a person is having good oral hygiene habit, that he wants to get up and brush his teeth, and while sleeping also, if that person is brushing a teeth, so that's a normal hygienic practice that person practices, so that's a good habit which will stop the disease. Whereas some people have a habit of smoking, so that is a lifestyle habit which is bad in that particular person, because of which they may become more susceptible to developing any kind of a cancer. So like this, lifestyle comes into way. And the third thing is environment, that is the source or reservoir for the agent of the disease. So environment may be internal or external. So internal exam, to give an understand to give you an understanding, internal environment means anything which is present inside your skin. Anything which is present inside your skin will make your internal environment, and anything which is present outside your skin, that makes your external environment. Okay, so any kind of temperature, or you would say the environment as in weather, then the environment around you, the work environment around you, that all are the external environment. Whereas inside you, if there is more acidity, if there is more cholesterol, or more high amount of triglyceride, so that is your internal environment. So classification of the environment may be physical, biological, or socioeconomic environment. We can divide into them. So we'll be stopping our lecture today here only. Next part of concept of causation we'll be taking into next lecture. Thank you.